So again, then number 4 is the weight gain that can happen in menopause, because in menopause, due to the deprivation of estrogen, there tends to be a decrease in metabolism. So if you have a decreased metabolism yet you are eating the same food, living the same sedentary lifestyle that you had before your menopause, then chances are that you'll gain weight significantly. And this weight gain, unfortunately, is usually truncal. You'll have like truncal obesity. Truncal is like the stomach area, the abdomen area, truncal obesity. And this could lead to other risk factors such as diabetes, such as hypertension. Then there are also skin changes that occur in menopause. So because of, again, the estrogen levels, then when you compound them with the normal physiological aging process that happens in any person, any animal, any mammal. So when you add all this, then you get a lot of skin changes, like the skin becomes very light, wrinkled, there can be itching, or the skin can become very harsh and itchy and cracking. Yeah. Then the other issue is dental changes. The epithelium, or the inner lining of the mouth, is very sensitive to estrogen levels. So when you have a sudden drop in estrogen levels, the inner lining of the mouth becomes a bit worn out and dried out, and this causes decreased salivation, decreased sensation. So as a result of this, you might experience, like, you might be complaining that your food is not as sweet as it used to be. You might be at risk of dental caries. You might be at risk of teeth loss. You might be at risk of a bad taste in the mouth and infections around the mouth region. Yeah. And the other issue is that they always say that how to estimate or gauge a woman's bone strength after menopause could easily be interpreted, or could easily be calculated by just assessing the number of teeth that they have lost in the early menopause or in menopause. Then the other thing is breast changes. Again, breast is it's not really a reproductive organ, but it's an organ that is very, very sensitive to, very, very sensitive to estrogen. Yeah. So this drop in estrogen that happens with menopause will cause the breast to lose the volume, to lose the alveoli, the proliferation of the breast. So the breast will be loose, sagging, will be having some breast pain, etc. Then another thing that you want to discuss is the effect of menopause on the central nervous system. So because of this drop in estrogen, again, and because of all these hormonal changes that happen with menopause, then you could have sleep dysfunction, fatigue, the quality of sleep declines. You become a very light sleeper who's waking at night by small things like noise or even body urges like urinating and or loudly snoring partner. So all this could impair sleep, and and all these symptoms in menopause, they come and intertwine and cause a continuous and endless cycle. Because again, I said there could be weight gain. So with this weight gain, and then now you're not sleeping well, and then you're also having hot flashes in between your sleep. So all this could cause you to have sleep deprivation. And the sleep deprivation could cause you to have depression, anxiety, fatigue, mood swings, etc. Right? So if you're experiencing these symptoms, then nothing to worry about. This is menopause. If you're having weight gain, work on the weight. If you feel like you're gaining more weight than you were before menopause, then work on it, right? And if it's so much, then you might need help, and we'll discuss that in the next topic. And then again, also things like urine, right? Urine agency, urination agency, so micturition agency. So in menopause, there tends to be an urge towards urinating all the time, because the pelvic floor muscles, the urethra, the neck of the bladder, they all depend on estrogen. Okay, estrogen really helps with the tensile strength and the connective tissue strength and compactment down there. So with menopause, there's usually you could be having symptoms like pain when passing urine, or burning sensation passing urine, or passing urine all the time. That is okay. That's just a physiological change in menopause. Because what happens with menopause is that estrogen again helps with the tensile strength of the muscles and the organs down there and at the urethra. So if you don't have this, or with that deprivation of estrogen with menopause, then things start to become a bit loose. So you might end up urinating more or feeling the urge to urinate more. So this will cause this might disturb your sleep cycle and at the same time cause you some people are very aware of this, and it affects them negatively. But this happens because of the changes that occur with menopause. Then, but again, we said in menopause, there's weight gain, there's all these risk factors to hypertension, to diabetes. So urinating so much could also be a sign of diabetes that can occur with the changes that occur with menopause. So you need to be investigated just to rule out anything. So it's not wrong to be investigated. Then another issue is cognitive dysfunction. So you'll realize that your concentration span or your memory may not be as sharp as it was prior to your menopause years, and that's okay, and that's fine with age. Then there are other issues that can happen down there. Libido changes. So the libido changes, it's an argument. Some people wonder whether it's really due to estrogen, or it's because of the issue, the changes that happen down there. So it's still a debatable issue, but some people think that issues that happen down there because the muscles, the skin, the tissues at the woman's reproductive organs, they rely on estrogen for their tensile strength, their water content, so they're beefed up, collagen, the strength of the skin, yeah. But with deprivation of estrogen with menopause, then chances are that the skin will become dry, flaky, right? Easy to bruise, pain. So they'll have pain when there's lack of lubrication. So there's pain on micturition. So when you're going to urinate, you might feel pain at intercourse, what you call dyspareunia, bleeding, yeah. And as menopause progresses towards later years, towards more advanced years, things down there literally close, like the introitus or the opening of the vagina literally becomes very tiny and even what you call stenosed, because of their lack of strength, muscle strength, lack of connective tissue strength, yeah. So this happens. Okay, so we don't know whether the libido is due to estrogen levels that affect the brain centers, or because of also the decreased testosterone that you had talked about, this decreased androgen steroids in the body, or due to the pain, the lack of lubrication, the discomfort, the urination all the time that happens down there. Right. So the other issue that will, the other change is increased risk of infections down there again. So the decreased estrogen will cause changes in pH, making it more alkaline. So a woman will be at risk of things like bacterial vaginosis. So it's good to maintain hygiene during menopause. So thank you for watching this episode on symptoms and signs of menopause. We're going to cover what to do with the signs and symptoms in the next YouTube video. Thanks for watching. Subscribe and share with as many people as possible. Thank you very much.